Good afternoon, everyone. This is the part 3 of counseling and mental health presentations delivered on 29th of January. In part 1, we deliver what is mental health, and in part 2, how to recognize the indicators of mental health. In this part 3, you will know all about the reasons of mental health illness and how counselor can help. So please watch this video, get benefited, get knowledge, and keep you safe. And thank you. There are two slides which I had to present in the beginning, but I am bringing later because at the end I am talking about the role of counselor. Okay. I believe whoever watching or who will watch this slide, they will understand the term, the English term, very simple terms, but it's understandable. And the possible reasons of mental illness. What could be the reason? Abusive. If the person is abusive or they face abuse, okay? Think about two ways. The person is abusive, they face abuse. Person is abusive long term, person is facing abused from someone else long term, okay? Just think from two ways, okay? Abusive, assault, bad behavior, constant aggressiveness, crisis. Crisis means any kind of health crisis, financial crisis, relationship crisis, okay? Critical incident. Someone got a critical incident, they lost their part of life and they couldn't recover themselves, okay? We can see Paralympians, people who are disabled, they are also winning the Olympic game, they are participating in the Olympic games. That's a good thing. Although their part of body are not working, but state of mind is very well. However, somebody falls in incident and they couldn't, their mind couldn't be recovered in some cases, in some situations. That also could be the reason of mental health illness. Similarly, dependency, long-term dependency also make people worry and anxiety and depressions, disrespect, feeling disrespect, okay, discrimination, economical reason, also the part of mental health illness. Basically, when people cannot stand on their feet and they are humiliated or tortured or or discriminated, of course, the economical reason, or they may have high expectations and they feel they are failed and they cannot recover themselves, those kind of feelings and thoughts, okay, or situations, of course, escalating stress, trauma, grief and sorrow, facing regular attack in happiness or in normal life. If someone is facing attack in happiness in the normal life, okay, false assumption, if we are assuming the things that are not true and we think it is true, that is also a big problem. And feeling or victim of rumorization. If someone is feeling their life is rumorized, used or misused, or they are really a victim of rumorized, the thing they have not committed, the thing they have not done it, the thing they never imagined, but they are blamed. Then the people who are blamed for the thing they have not done or committed, they become sick, they become stressed, and continually if it is repeated, that escalates mental health situations. Okay. भनेपछि यहाँ चाहिँ बुझ्नु भयो अलिकति म यहाँ नेपालीमा पनि थोरै भन्न चाहन्छु यो र्युमराइजेसनको विषयमा चाहिँ तपाईहरु को सुन्नु भएको छ मेरो अहिले यहाँ फेसबुक मैले हेर्न मिलेको छैन भोलि मिल्यो भने पनि हेर्नु होला मैले यसलाई यो चाहिँ स्लाइडलाई चाहिँ मैले थोरै भोलि कट गरेर सानो बनाउन पनि सक्छु अहिले चाहिँ म यो मेन्टल हेल्थ एन्ड काउन्सेलिङको कस्तो खालको रिलेसन छ भन्ने कुरामा चाहिँ यो प्रेजेन्टेसन गर्दै छु त्यो रिलेसनमा चाहिँ त्यो रिलेसनकै पार्टमा जान भन्दा मेन्टल हेल्थको चाहिँ डिफरेन्ट चाहिँ मेन्टल हेल्थ भनेको के हो यसका प्रकारहरू कस्ता छन् यसका चाहिँ कन्सिक्वेन्सेसहरू के हुन्छ यसलाई कसरी चिन्ने अर्थात यसलाई चाहिँ के कस्ता चाहिँ रिजनहरू हुन सक्छन् भन्ने कुरामा चाहिँ मैले चाहिँ अहिले चाहिँ धेरै इन्फर्मेसन यो स्लाइडमा ल्याइरहेको छु र त्यो इन्फर्मेसन ल्याउँदै गर्दाखेरि चाहिँ त्यो इन्फर्मेसन हुनु भनेको नै एउटा काउन्सेलरलाई चाहिँ मैले जति इन्फर्मेसन ल्याएको छु अल्सो अझै धेरै इन्फर्मेसनहरु चाहिँ काउन्सेलरले चाहिँ जान्न पर्ने हुन सक्छ जानेका हुन्छन् राइट र अब हेल्प गर्ने कुरामा चाहिँ काउन्सेलरले चाहिँ यो इस्युजहरू के हो त भन्ने कुराहरू एसेस गरेर आइडेन्टिफाई गर्नलाई काउन्सेलरले हेल्प गर्छ र काउन्सेलरले चाहिँ वेलबिङको लागि चाहिँ कसरी उनीहरूको चाहिँ नेगेटिभ थिङ्किङलाई पोजिटिभ थिङ्किङमा चाहिँ कसरी चेन्ज गराउने भन्ने कुराहरूमा पनि काउन्सेलरको चाहिँ ठुलो रोल हुन्छ, रोल खेल्न सक्छन्। र यदि मेडिकल पार्टमा चाहिँ जानुपर्ने, ट्रिटमेन्ट पार्टमा जानुपर्ने अथवा कुनै एउटा चाहिँ हायर लेभलको चाहिँ साइकोसिस चाहिँ बिहेभियरल कग्नेटिभ साइकोसिस बिहेभियरल चाहिँ प्रब्लमहरू चाहिँ गढेको प्रब्लमहरू छ, डिसअर्डरहरू भइसकेको छ, थट्स डिसअर्डर भएको छ, लेस इक्जाम्पल सिजोफ्रेनिया त्यस्तो छ भनेदेखि चाहिँ मेडिकल एटेन्सन गर्नुपर्ने हुन्छ। त्यसको लागि पनि काउन्सेलरहरूले चाहिँ त्यो कुरालाई उनीहरूले चाहिँ यस्तो भएको छ भन्ने होइन कि दे विल रेफर द क्लाइन्ट टु द साइकेट्रिक अर मेडिकल फर द मेडिकल एटेन्सन. So it is very significant role. Counselor and therapist are very important, the stakeholder of mental health patient. Every single person is a stakeholder, as I already told you. Family member, pretty much in the basis at foundation level. Family member are the genuine stakeholders. Then community workers and health professionals. Okay. And high level of psychiatric and medical health professional will give a treatment for the mental health illness. However, counseling is not a treatment, is not a treatment, it's not a medical treatment. Counseling is not a medical treatment. Counseling is helping client to identify the real issues, needs, desires, problems, okay, and helping them to set the goal to reach their and assist them to reach their goal, and also helping them to identify their hidden capabilities, knowledge and skills, and what they like, what fit with them. And counselor use various kind of techniques and the counseling techniques, and also the let's example talk therapy, okay, they use it, and metaphor techniques, and then they continue to support the clients in order to get their good well-being and better life as well. And counselor also work to refer the client into the various, I told you Maslow, the basic needs and real actualization, self-actualization, need hierarchy of the needs, those kind of things. And counselor will be able to manage a client as a case manager, case worker, as a counselor is also a case worker, case manager, to manage the case in order to fulfill clients' needs, resolve the issues and fulfill the needs. So these are the important things, important roles counselor do it. And in case of reason, so those reasons when counselor have a session with the client, counselor will be able to identify whether client is expressing the abusiveness or assault they felt, and those kind of reason I'm listing here. That's why I put these two slides at the last, because this presentation is pretty much related to counseling and mental health. That's why those reasons are important. Reason to understand which may bear, which may lead a person to a mental health illness. And it is very important, and counselor will help to identify all those reasons, and they help, and they also provide the referral service to get the treatment path. Similarly, there are other few things like, the feeling alone and left abandoned, fear of loss of status, feeling or facing hate is genetic and myth. I have put the question there. People say mental health, somewhere we can find mental health is a genetic, like blood pressure is a genetic. People say mental health is genetic. Is it really a genetic or is just a myth? It is important. It is also the part of research. Okay. High level of physical and sexual abuse in home, hospital, and prison as well. And this data is from UN data, UnitedNations.org. I take that line from UnitedNations.org, and most of the things as well. Like, the people who feel high level of physical and sexual abuse and in hospital and prison suffering mental health illness. And of course, because of like unmatched ID, ego, and superego attitudes, long-term physical weakness, pandemic, epidemic, and environmental, like kind of COVID crisis at the moment, and lots of people are suffering from mental health. It is not magic, but it escalates one by one. People have lost their loved one, family members. They are suffering from griefs and worries because of bereavement. Okay, so they are also the reason. Pandemic, epidemic, environmental factors are also the reason. Psychological, of course, I'm talking entire slides about the thoughts and feelings, cognitive, and they escalate the emotions and behaviors. So psychological factors, stigma, humiliation and disgrace. People feel themselves humiliated. They feel hurt by other people all the time, long time, and they feel humiliated, and that stigma also indicator of mental health illness. And disgrace, a graceful people, if a graceful person is behaved by a disgraced person, that is also the indicator of mental health illness. Similarly, biosocial economical factor is also reason. Bio is a human being, biological factor. Social factor, the things we need externally. Okay, and economical factor, of course, economy is a part of the part of life as well. And spiritual and religious factors, they are also the reason of mental health illness. Because of religion is actually the methodology that bring people in a discipline. They teaches and inspire people not to do antisocial behavior and bring in the discipline in a path. And every single religion has their own philosophy. Okay, but the main thing is bring the people in discipline. However, on the name of religion, if people are over controlled, supremacy, feelings of supremacy, men are created, for example, if we say it this way, men should control the women, if we say this way, if religion says that way. Okay, that will suppress the other counterpart of human being, and those kind of behavior also may escalate mental health illness. Similarly, unfair judgment and violence and others. Okay, I'm not going to repeat all about the violence. Of course, domestic violence, social violence, community violence, workplace violence. They are also the reason of mental health illness, someone's mental health illness. So these are some sort of reasons. And when a person is with counselor, I'm definitely I'm 100% sure that counselor will be able to identify it. Not all the people will not face a whole entire region. One person will not face entire region. Some people face some region. Some people may face some other regions. So if they are with the counselor, definitely counselor will help to identify what exactly is happening within the client. Okay, and it is very helpful. This is what the counselor role is, identifying. They use a technique. It is not just like going back and looking someone's in a face or in the clothes or what they eat, and then they just say, okay, this person is like this. This is a judgment. Okay, counselor cannot be a judgmental. They use the judgment in order to help them, to give them justice. Okay, to give the client justice. Now, again, I already came back to the role of counselors in mental health illness. So identifying the issues, reasons of mental health illness. They will not assess, means not the entire the path of treatment. They will not put the client in the path of treatment. They will like identify the issues and reasons. Okay, as I already explained a lot. Similarly, counselors also are able to use various kinds of model, integrated model of treatment, community model of treatment, spiritual model of treatment, grow model. I already say the grow model is a crisis intervention sort of grow model. Okay. Solution focus model, counseling with various therapy, change model, psychosynthesis model of counseling, person-centric model of counseling, constructivism model of counseling is a kind of learning therapy, and it is very useful because it's a part of educating the client. It's a constructivism. To construct them, if client is educated, they supported to understand what is happening. Let's say example, substance use disorder. Make the client understand what is substance, what quantity they use, what is the impact, what will happen next year. If they stop, what will the result? What will be a changes? Those kind of the education providing to construct a client from bad thing to bring to the good situation. Similarly, is and the constructivism is very useful in youth life, because youth and adolescents, schools, college, universities, these adolescents and youth, they are excited, they consume, they may consume, if they are in the bad circles, they may consume some alcohol, drugs, or we don't know. So it is the people who are in risks, the pretty much youth and the college students, university students, if they are in that situations, constructivism is very useful. So and the counselor will use multiple techniques in one package. The constructivism in one part, again they will look at if the client is needed like medical attention, they will place the referral things. So in one session, they use couple of techniques. In the other session, they may use the other couple of techniques as well. So this is the role of the counselor, who can use various kinds of models and techniques in order to help the client of mental health. If counselor will not diagnosis that client has a mental health illness, counselor will not prescribe any medicine for a mental health illness. It is not the role of the counselor. It is very important to understand here. I don't want you misunderstand without watching and listening to me. Okay, that's why I brought this presentation. Pretty much people have confusion. Okay, so if you have any issues about thinking, feelings, emotions, counselor is very helpful, is a very footstep, is a professional service which help you entirely to look at your the holistic aspect, using various kind of models and techniques to identify your needs, problems, issues, and to help you to set the goal, to help you to get your better life, to help you to grow your well-being, and also to help you to go path, to seek a path to the medical line, medical attention, and social welfareness as well. So it's a very good thing to seek a help to reach at the counselor. Similarly, from this slide, basically I took this information from WHO. What it says is I talk a lot about community. You can see community treatment model, but I haven't explained what it is, how it works. I already told this is a part of interest. It's a question in my mind, and it is an area to research as well, further research as well. Okay. However, there are lots of talks about community treatment in the media, in the news, in the literature, in the journals, and in like government's legislations, policies as well. And what WHO, World Health Organization, says here is community worker, health worker provides who are affiliated with the primary, secondary, and tertiary health care service can be trained in using scalable psychological intervention to bridge the gap between in the availability of evidence-based psychological services. It's a complex, but what I understand, in my understanding, is the community worker and health worker. The health worker, counselor as also the part of health worker. There is a boundary, there is a like what they can do, what they cannot do, what a health worker, what type of health worker are they? It's a different criteria. Okay. When they are a health provider, including counseling and counselor and therapist, okay, they are, it seems like they are not trained how to intervene the psychological disorder patient. We are talking about community treatment. We are talking about people are in the community to treat. Sometimes I think only the psychiatric or the doctor monitor the patient in the community. What does that community treatment mean? If the patient is in the path of community treatment, and they are monitored by the people who are not qualified to intervene the psychological level, psychological disturbance, then they may mislead the client. There is a concern. There is my concern. So this is what I was thinking. In the previous slide also, I was talking about electronic monitoring. Who does it? Are they qualified? Do they maintain the privacy? Do they respect the client? Who does it? Where it will happen? Are people known about it? So what does the community treatment mean? Is it only based on the like non-profit organizations or any organization or any provider in the community who provide the health service, or there is other techniques? So these were the questions in my mind since a couple of months ago. Now, while preparing this slide and presenting the other slides as well, preparing this slide basically, I found one statement presented by WHO, World Health Organization, which says the community worker and health provider, health care worker, if they are helping the mental health people, if they are mental health worker or supporter worker or healthcare worker, they should be trained how to intervene the psychological disturbance. If they are well trained, then they will help to fulfill the gap between the non-evidence and evidence-based. Because if they are trained, they bring the evidence-based things. They produce the evidence when they work with the client. And these evidence will be very helpful for the higher level of treatment as well. So I feel it is very useful things like presented by WHO. That's why I put in this slide. And I hope I brought lots of information and I made clear what the role of counselors are in terms of supporting the clients who are suffering from mental health illness. So again, at the last, what I would like to tell you is counseling services is not the mental health service. Counselor are not the mental health worker unless and until they are well trained or qualified from other parts. However, counselors are not the mental health supporter as well. However, counselors are the healthcare provider, healthcare workers, okay, and they have distinct roles than the people in hospital or in health sector or aged care or the hospital sector. Okay, they have distinct role. Counselors have distinct roles to provide, to care the people. And also, if counselors are, as WHO told, if counselors are provided additional training how to intervene the psychological things, psychological disorder. It's not only counselor. Here I'm talking about community worker, health worker. Okay. Counselor is basically they use various kind of techniques to identify the issues about the thoughts. If they need a mental health like treatment or medical need to go to medical path, or they need to go, client need to go to like cognitive behavioral therapies, then they refer the client to the to the higher level of medical treatment. And also it depends upon counselor's level. I, as a practicing counselor, I will not use psychoanalysis technique at this stage. But when the counselor level increase, they are qualified to use even psychological techniques as well. So it depends upon the level of counseling as well. So it is very important to understand the counselor will play a significant role to help the people suffering from the well-being issues. Okay. And if they are more trained, of course it is further benefited. If other community worker or other health worker are also like trained, it is further benefited. It's like first aid, mental health first aider is a supplementary skill for a counselor. They can intervene it. Okay. If anyone work in the child care and they have mental health first aider some skills or how to intervene the psychological or dementia patient or disabled patient who have little bit issues with the thoughts and feelings and emotional things, they can save client life, they can save themselves as well. They defend themselves, they defend for client as well. So this is very good thing to give an extra advantage to the healthcare worker in order to support, to build the skills in the areas of mental health illness. And it is important because I already showed the global data that 70 to 85% of people are ignored. People who are the mental health disorder are ignored in the society at the global level. So more education, more awareness, more skills bring more those kind of the more thing, more education, more awareness bring the issues down. So in schools and college also sometimes I think it is not only like we put a course of mental health, subject mental health. It is not only that we put a unit like mental health unit. Why not we put some sort of words, those kind of words, the terms, relevant terminologies in every sectors. Let's say example, there is a business course. We talk about work discrimination. Why not we put some sort of the compulsory part of learning in terms of understanding the legislation, work legislation, in terms of understanding the domestic violence. So the typical, like, some sort of terminologies plays vital role. People need to understand the terminology in the beginning. So instead of only taking or enrolling the unit or choosing the subject in education system, I think those kind of, like, the mental health illness issues and domestic violence, different violence, substances use, and those kind of disorder, those terms should be used somewhere relevant to the business course, relevant to the health course. Health course, of course, it will be there, I believe. Even counseling course, there were some lacking behind, which I studied, I saw. Okay, so I think this is pretty much enough. And then in conclusion, of course, anyone can suffer from mental health illness, stigma, violence, discrimination, cause mental health illness. There are a number of other reasons as well. Mental health illness may lead the disability and life-threatening situations. Mental health illness can be treated. Of course, it is dangerous, but it can be treated. Also, we have to improve in, improve in beliefs in myth, then genetic, like mental health is a genetic. People think genetic. It is not genetic. It is a beliefs only. So we have to understand that thinking it is a genetic is a myth. It can be treated. The consequences of mental health illness can be life-threatening. Understanding and paying respect are indispensable. Being responsible to fulfill the respect model is essential. I know there are lots of other model. However, respect model is pretty much very simple and useful in day-to-day life. In family life, individual life, community life, work life, everywhere it is very useful, very simple. That's why I put it there. And counseling service is a footstep for mental health illness as well. So reach out to the help. So we have to, these are the conclusion. And of course, there are few numbers for mental health support lines. You can see if you are suffering from grief, you call 1300 845 745, health direct 1800 022 222. And you can also check the symptom of mental health directly in online in the health direct website. If there is any emergency, of course, do not feel alone and do not keep you in danger. Dial 000. Suicidal thoughts, you can also dial 000, no problem. You can also like if you are feeling harming yourself, is a suicidal thoughts, harming yourself or harming others, it's a 000, dial 000. You can also dial lifeline 131 114 and Headspace if you or your children are below 25 years old, 12 to 25 years old, adolescents or youth and adolescents. Headspace is a national service funded by federal government, and there are lots of Headspace office in different regions and in a national number as well. They can be contacted as 0390270100 is a national number. Similarly, Embrace Multicultural Mental Health Support is a kind of non-profit organizations. We can contact there as well. And the Forum of Australian Service for Survivor of Torts and Trauma, we can contact in 0733916677. And Age Care COVID-19 Grief and Bereavement Service. Of course, this is a pandemic situation. It is still around us. We're losing our loved one, and the community members as well. And if there is a situation of grief and bereavement, you can get the service at 1800 222 200. Okay, and Mental Health Australia is 0262853100.
and mind frame 024924690. So this slide is prepared focusing in Australia. And if someone is watching from other country or other regions, please prepare at least the national hotline contact numbers and provide this information to your community. This is very helpful. Here you go. Finally, any question? If you have any questions, please feel free to contact me. I'm not the perfect one, I'm saying. However, I will try my best to help you. I'm a practicing counselor and qualified education counselor. Whoever has issues in education matter and that is impacting to their life matter, surrounding matter, I'm qualified to counsel you. So all the international students, no matter what language you speak, if you would like to talk to me, you are welcome to talk to me. You contact me. And for other general public also, as I am a practicing counselor, the counselor registered with Australian Counselling Association, and I'm also under the clinical supervisor regularly and in the process of upgrading my counseling levels. However, at this stage, I'm providing the private counseling services. So please do not hesitate to reach out me. Please do not hesitate to refer to your the people you know, the student you have who needs help, supports to build their life, well-beings. Please reach out me. So office level 14-3, Parramatta Square, Parramatta. I appreciate if you book it for the face-to-face meeting. And you can also leave a message or contact us at 9615-9779 and in my mobile 0422837072. And I do have another number 0406039526. Once again 0406039526. For people who have my old number 0422837072. And you can also send me email at info@jEDU'L.com.au or jEDU'L@gmail.com. I'm Janaki Paudel. I'm delivering this presentation from Sydney, Australia, on behalf of my own sole business, jEDU'L Consulting. And finally, I'm a qualified education agent counselor and practicing counselor as well. Thank you very much for being with me, and thank you for reaching at me. Thank you for watching my video. You can also watch and share this one to your family and friends and in the business as well if you like. There are a couple of mix in the language. I have spoken in Nepali in somewhere. You can avoid it. However, entire presentation is in English, and I have spoken more in English. And I believe it is very simple. I believe I have explained in a simple manner to make you understanding. And if there is any concerns about your situation and any concern about even my presentation, you are most welcome to reach at me. Thank you very much and have a good afternoon. Enjoy a lot. Thank you.